I now invite Dr. Seema Khanna ji, the Deputy Director General NIC. She is looking after Aarogya Setu. Um, I'm sure the whole world knows about Aarogya Setu. So I would certainly pose certain queries which will help us to get a deeper insight into the mammoth application that perhaps every Indian citizen who's illiterate or owns a smartphone is using. Ma'am, we welcome you here in this panel. Ma'am, as Aarogya Setu is one of the landmark technology innovations which has come out during the COVID pandemic. Can you please provide us some insights about the early days of Aarogya Setu and that how this app was designed and what was the thought process that went behind it?
Thank you, Dr. Sood, and I would like to say good morning to everyone. And before I get into what I want to talk about Aarogya Setu, I just want to tell that it's always a pleasure hearing Sharma sir speak and Praveen ji speak, and it's an honor to be a part of a panel where Sharma sir is leading it. So it's an amazing conversation every time we have with him. So thank you, sir. And now let's go back to Aarogya Setu, Dr. Sood. Aarogya Setu has been part of conversation for over 2.5 years now, almost 3 years, more than 3 years now. And every time this comes up as a conversation, I travel back in time. I wouldn't like to take the credit of being the vision behind Aarogya Setu. It came right from the top, Honorable PM. I'm carrying a legacy forward. And yes, today I talk about Aarogya Setu a lot because I'm taking this conversation of Aarogya Setu. But we need to understand that what triggered Aarogya Setu to begin with. I'm sure many people would be aware of it, but because I was in the middle of the storm, let me just tell you how it all originated. Aarogya Setu, when India was taken over by COVID, we were all very flummoxed about how to deal with it. And we are a very large nation. You've heard Praveen ji speak. I mean, we don't talk less than billion. We are a very, very large country. So anything that we wanted to do was meant to scale. Now, we had been talking about technology. India has been a front runner in technology. So technology was not the problem. It never was. But if I'm allowed to say so, Aarogya Setu was the trendsetter of mammoth rollouts. Because at any point in time, none of us could predict how many are going to start using it. We don't know how, we had no clue how many are going to onboard it. But the hope was that if we roll out a technology, it should be embraced by the entire nation because the endeavor was to save the entire nation. To safeguard everybody. So this conversation actually started very soon when the nation was getting into the storm, and the decision makers had a very senior level meeting, and it was decided that humans cannot do. And it was understood because by that time, the epidemiologists and doctors like you and many others, Praveen ji, I mean, there was a consensus that it's going to be spreading by contact. People had understood what COVID is trying to do. It spreads by contact. So we had to know who's infected. And there was no way of doing it manually. It's not that contact tracing as a concept was new to India. Contact tracing has been going on since smallpox, since polio. You would be more qualified to comment on this. But this is a concept that has been going on forever. And the only difference here was that we did not have the luxury of time. You had to immediately know if Seema is infected and if the Seema is capable of spreading it to the other person. So human intervention was ruled out, that it's not possible that the pre-medieval times of understanding contact tracing could be affected in what the country was facing at that point in time. So technology had to come to the rescue. There was no debate on that. Now, what are we talking about technology? So technology, the key pillar stones of what is required were totally understood. And at that time, the nation came together. I mean, I've yet to see, I've put in fair amount of years in my service, but I've yet to see a nation come together. You know, it crossed and transcended all boundaries. Technology, visionaries, innovations. I mean, today we are in a position to have this conversation today, and such an intelligent conversation, such a brilliant conversation, because COVID actually set the trend of people coming together. It united the nation against one common enemy. So I always keep saying the statement over and over again that we as a nation did not waste a crisis. If today we are stronger, both from a technology standpoint, both from an empathy standpoint, because we all empathized with so many people. It brought out the human emotions very well. COVID in the past 3 years had brought out him. People were willing to share what they had in terms of injections, in terms of medicine. So Aarogya Setu, we were given a vision to roll out. We means at that point in time, the teams leading it, that we were given a time of a couple of weeks to roll out Aarogya Setu. So everybody, volunteers, academicians, technologies, everybody came together and a blueprint was drawn for Aarogya Setu. Aarogya Setu was going to be rolled out. Time given was a couple of weeks. So imagine rolling out a technology that is supposed to handle the scale for an entire billion people, not break, not deliver. Now, let me give you a very trivial example when we talk about Aarogya Setu. All of us have seen Aarogya Setu in our apps. We all know the power of Aarogya Setu. We know how much it helped the nation. But let me break it down to the most common denominator, the most common trivial element of Aarogya Setu when we talk about leveraging technology. I'll talk about SMS. I mean, SMS is the lowest end of the food chain. You are aware of that, Dr. Sood. It's the lowest end of the food chain when we talk about technology. But Aarogya Setu cannot even be registered if an SMS is not delivered to a normal person. And we do not have patients. We are struggling with a disease. We are struggling with trying to live. We're trying to survive. And at that time, if as a citizen, I'm trying to download Aarogya Setu and OTP nahi aata hai, it'll fail. You get one shot at trying to convince a citizen that this is good for you. You do not have the luxury of going back to a person who's anyway in pain and tell him, yaar, ek baar koshish kar lo, dobara download ho jayega. So technology had to be end-to-end driven. There was no room for error. So I remember the day when Aarogya Setu was launched on 2nd April, at that time when Honorable PM announced and the kind of floodgates that opened. And that was the true test of the application. We were sitting in the room and we saw the scale and the numbers going up and how it went. And today it's 22 crores. This 22 crores, a very large chunk of it was actually downloaded during that initial time. Now, because we are transiting, and I hope I get a chance to speak about the transition of Aarogya Setu, but now that we are transitioning, the numbers are not jumping at the speed when they jumped at that point in time. But at that time, even something as the lowest end of a food chain, SMS had to be delivered in under 2 seconds. Otherwise, you do not expect somebody to download it. Then the challenges that came when we were talking about a rollout at scale. Firstly is scale, which I've been saying again and again, that we had to have a technology that delivered on the scale of the nation. Second, language. Sharma sir also talked about it. We are a nation with multi-languages. You do not expect somebody to embrace just because English mein hai. So there was no way we could roll out an app which was plain vanilla English. It would never have worked. It would just, so from day one onwards, it was English plus 11. So we had to go out with all primary languages of the nation. It all takes time. You can imagine the scale. It all takes time. Translating every screen, crunching every screen, it all takes time. We had to do that. We literally did that. Then the other challenge, which Sharma sir spoke about it, because the challenges that COVID faced, Aarogya Setu faced the same thing. Feature phones. Kitne smartphones hain? I mean, if you talk about the TRI statistics, you're talking about maybe 54 crores or something. That's the amount of smartphones, but we're a country of billions. What do you do about the rest of the nation? Everybody has a feature phone. So not many people know that Aarogya Setu is as part of a smartphone. But during the time of COVID, we as a nation even rolled out a toll-free number called 1921. I don't know how many of you know that there was a toll-free number 1921, which was given, which was the COVID helpline in terms of self-assessment. That a person with a feature phone could call that number and register his symptoms. Once he registers his symptoms, that feed was going back to NHA, and at that point in time, then they were collecting that information. They were finding out that this citizen is actually symptomatic. A callback was going to the patient, taking his, and then connecting him to a doctor, getting him the first aid. So you can imagine the ecosystem that was rolled out for everybody, and it was an end-to-end chain that worked so well. You would be surprised at the number of calls we were getting at 1921, and then segregating those calls. Like we said, one household, a poor household has got one number. लेकिन उस घर में लोग तो 5-6 हैं. 5-6 के साथ एक मोबाइल नंबर मैप्ड है, लेकिन हमें तो 5-6 के सिम्टम्स लेने हैं. उन 5-6 के सिम्टम्स को लेने हैं, उन्हें असेस करना है, उसके बाद उसको फर्स्ट एड देनी है, उसको डायरेक्शन देना है. So that was a huge challenge in itself. Then the fear factor that was generated as a result of COVID. I mean, technology was coming to the rescue, but today, Praveenji also said that statement. Today, we are in a position to convince a citizen to more readily adopt technology, which was not the situation 3 years back. It was a very difficult task to convince a citizen कि भाई ये तुम्हारे हित में है, आप इसको use कीजिए. That was a different conversation. Today we can have a conversation at a more enlightened level. But 3 years back, that conversation was very difficult to have. So what people were doing was कि wrong number डाल दिया, भाई मुझे मेरा पड़ोसी पसंद नहीं, उसका नंबर डाल दो. If I'm going to be tested positive and मुझे पता है मेरे सारे symptoms है, मैं अपना नंबर ना दे के I give it for some wrong number. So obviously that person is showed positive in ICMR. ICMR was a very key element of Aarogya Setu because Aarogya Setu cannot decide that Seema is infected. Aarogya Setu had to get the feed from somewhere. I don't know how many people actually went into how the Aarogya Setu actually worked. There was a point in time to convince the people. We had come out with a flow also on how to tell how Aarogya Setu declares you as positive. Because at that point in time, the key element was ICMR. If a citizen is going and getting his blood checkup done and he's declared positive, the first place where he's detected and declared positive was the ICMR database. Now that's a separate conversation we can have because at that point in time, because the middle eco framework that today Sharma sir is leading, Praveen ji are leading, is at a much different level. I'm talking about 3 years back when the data pipes were not available. The data pipes had to be built overnight. So ICMR may, if a citizen has been declared positive, that data had to reach Aarogya Setu that this citizen has been declared positive. Then Aarogya Setu starts doing its contact tracing, which is again a separate point, which I hope I can talk about it. But if how once the data reaches that citizen X has become positive, then Aarogya Setu actually starts building its intelligence on that and declaring its contacts as positives or put them in the yellow name depending on the proximity, etc. So that was another challenge, that people actually entering a wrong number. So ICMR के पास गलत number पहुंच गया, गलत number positive declare हो गया. As a result of that, जो उसके आसपास के लोग हैं वो गलत symptomatic declare हो गए. So you know, there was a point in time when people felt that we were creating more chaos than help. Because at that time, it's technology. Technology, Sharma also, it's an enabler. It's going to do what you tell it to do. It's not built on human emotions to that level कि मैं सोचूं कि सीमा तो बिल्कुल ठीक-ठाक लग रही थी, ये positive नहीं हो सकती है. That's not how it works. If the number has reached me, I'm declared positive, then the system starts crunching. So that was another challenge. Then human error. अगर मैं जान के भी नहीं डाल रही हूँ गलत number, 9 की जगह 8 हो गया. That person gets declared positive. So there were a huge number of challenges that we faced post rollout also. So like it was a tremendous journey. From as a technical person, I absolutely was amazed with what we rolled out as a nation. Aarogya Setu put India on the global map. That's a very proud moment. Ki bhaiya, isko, we brought them to India on a global map. It was the most downloaded app globally. Within the first 20 days of its rollout, it was the most downloaded app. We were WHO, you name the nations who were approaching us as how we did what we did. So it was a very brilliant journey. As a technology person, it was an amazing experience. And I am sure I'll go to my grave telling this experience again and again till I go, because it's been a tremendous journey and it did a purpose and it served it well. And it continues to serve it well. So I hope I answered your question, Dr. Su.
Thank you very much, Dr. Seema. Ma'am, I do what we get out of the entire story, which is really thrilling, is that the problem statement for developing Aarogya Setu, the foremost point was inclusivity, that the entire population had to be included in it, be it the smartphone users or feature phone users or Hindi speaking population, or maybe just about any language they spoke. So that I suppose is the biggest challenge for any technology developer, and especially in a country which has such a diverse set of populace. This was indeed the biggest challenge any technology developer could have ever faced, and we thank the entire Aarogya Setu team for scaling over this challenge. And the other aspect that you mentioned was that the ICR element, that the information that you were picking was very sensitive, and it had to be very efficiently or very accurately picked from the databases residing in the ICMR's domain. So that certainly added the element of sensitivity into the entire application. But we once again congratulate the entire team for pulling it off, and we are really proud of the team and the application that has come out of this kind of an effort, ma'am. And ma'am, can you also help us to understand how the contact tracing in Aarogya Setu worked?
Dr. Sood, firstly and foremost, Aarogya Setu has now been rebranded. It's no longer a contact tracing app. In the sense, with effect from 1st April, we shut down contact tracing, because although COVID is not yet eliminated completely from our life, we hear a lot many cases, but it's diminished to what it was. So we have shut down contact tracing. We have shut down in a manner from a technical standpoint that tomorrow, God forbid, the nation needs something similar again, it can be activated in absolute immediate times. But as of today, the contact tracing element of Aarogya Setu is shut down. It's not operational anymore with effect from 1st April. But to answer your question as to how contact tracing worked, because the nation at that time needed a contact tracing app, so launched as a contact tracing app. It had two key elements, GPS and Bluetooth. So it required these two things to be enabled before the app could actually start functioning. So it works very simple. The moment two people who have got Aarogya Setu on their phone come in close range of GPS, of Bluetooth, they share information, encrypted information, it's shared, which talks about its proximity, its duration, its time. That data is stored on the respective phones. On the respective phones, there was another misconception that the data is going everywhere and all that. That's not true. Aarogya Setu was built with privacy first as an idea. That was the basic thing, because privacy was something which is very private to all of us. Although I have a different view when it comes, because privacy is very private to all of us. But when the nation is at stake, privacy needs to be understood in a different context. You cannot take privacy at that time and say that just because I want to call it privacy, I'm allowed to infect another person. That is a different conversation, which might be limited to my personal views. But again, we are all aware of the rearing storm that the term privacy caused at that point in time. But again, emphasizing that the data that is collected is in the respective phone that is held in the hand of the individual. It's going nowhere. It's going nowhere. It's residing very much there. But unfortunately, if somebody was detected as positive, at that point in time, because Aarogya Setu had to start doing the number crunching and identifying that now from ICMR, I have got the data that this particular individual has been declared positive. So now the purpose, the very purpose of the app has to get triggered. And that is to tell the people who came in contact with that individual that you are in a risk. You need to get yourself tested so that if you've been in close proximity, how many times you interacted, not how many times you're a very close neighbor, you go and have tea with that person every day at 11 o'clock. But if that person has been detected positive, then there's a very large probability that you have also turned positive because you've had a couple of half an hour, 40-minute sessions with him, having tea with him. So it's the job of the app to tell you that you are at a risk. So please get yourself tested. You'll be amazed. We had a 25% hit ratio when it came to number crunching, which was the highest ever in telling that which people we told that you get yourself positive, they were turning positive actually. So contact tracing was very simple, but the only element that was required was GPS and Bluetooth to be enabled, which was primarily required.
Thank you, ma'am. Ma'am, some critics claim that contact tracing apps from other countries were not as intrusive as Aarogya Setu because they don't use GPS and they use the contact tracing API of Google and Apple, which is more transparent and protects users' privacy. What is your response to such critics?
Again, privacy, Dr. Sood. I mean, this is going to take us to our grave. But then again, this is a misconception, absolute misconception, because one thing we need to understand, how every nation has a different ask. India has got volumes. You cannot compare India with a normal nation. We have to deliver technology which serves our purpose. Google and Apple, brilliant technologies, no debate on that. The technology person in me can very much appreciate what they do, but they need to understand the ask that we had at that point in time. You cannot say people said it was less intrusive, but the very fact that it was not serving the purpose we had. They were just talking about the day of exposure. They were not talking about proximity. They were not talking about the number of times you went. And we had to enable contact tracing. What am I going to do with the day of exposure? If I was exposed, let's say if I'm sitting in a park and I'm exposed and I come in contact with somebody sitting in a park, that's not going to be as damaging as I come into contact with somebody if I'm traveling in a lift to, let's say, 20th floor, or I walk into an office, or if I'm in a market space and trying to buy something in a store at that point in time, and then I come in contact. So it was how you adopted technology, how you use technology. So we just wanted, for us, a day of exposure was of no relevance, because we had to tell that you have come in contact with the person who's come positive. So day of exposure was not enough. We had to tell proximity, we had to tell the number of time, we had to tell the duration, we had to tell the number of interactions. We needed all this data for us to make sense of the madness that was happening around us. So this statement is not true, and we have answered it at various forums also. So this was not true, and I'm glad that people actually understood what we are trying to say, because this was never raised to us again. This came up as a conversation very many times during the journey of 3 years Aarogya Setu, but we put everybody at rest. We convinced them that that is not true. This was the ask of the nation, which is why today that ask is no longer relevant. So we have shut down contact tracing. Tomorrow, God forbid, we need it, we will take it up again. But today it's no longer relevant, so we've shut it down.
Thank you, ma'am. And then the COVID-19 pandemic, as we all know, now is on the decline. And thankfully, we haven't seen any huge waves of this pandemic, at least this year. With COVID-19 moving out of the picture, do you still think that Aarogya Setu can stay relevant in a post-COVID world?
Absolutely, absolutely. I think we've heard Sharma sir speak about it. We've heard Praveenji speak about it. Aarogya Setu, like I said in one of my earlier statements, Aarogya Setu is no longer a contact tracing app. It's transitioned to being the national health app under the very able leadership of Sharma sir. Now we have weekly meetings. You're also aware of that. We are now transitioning. Aarogya Setu is now the national health app of the nation, which implies that we are now tightly coupled and integrated with ABDM. That is Aarogya Setu's lifeline. It's not the reference app for ABDM. ABDM is a brilliant ecosystem. I may not even talk about it. We've heard Sharma sir speak. We've heard in-depth conversation with Praveenji. So we know exactly where they're headed. We know exactly what they're trying to do. Aarogya Setu is going to be the face of that from a citizen perspective. We have integrated, for those of the audience who have the Aarogya Setu on their phone, which is a very large number, you would see the transition that's been happening in Aarogya Setu. Now you can create your Abha. Even before we integrated with ABDM, Aarogya Setu had started its transition, because we had tightly integrated with CoWIN. Today, we have taken it to next level by being integrated with ABDM. But when CoWIN was launched by Sharma sir and Honorable PM, at that point in time, we had integrated with CoWIN, and we had made it the reference app to register for the appointment and download your certificates, and download for everybody in your family. You could register. So we were a reference app for CoWIN at that point in time, which we continue to be. Now we've taken it to the next level by becoming the reference app for ABDM. And as a result of that, anything that's onboarded in ABDM becomes part of Aarogya Setu. If you pick up Aarogya Setu today, you would see it's tightly, now we have even launched eSanjeevani, which you are leading. So we have integrated with eSanjeevani, which is a brilliant thing, because now the way we have adopted technology, you need not actually walk into a patient to do a doctor's office. You can do it remotely, thanks to you. We have registered as a blood donor. We have find the lab. We are going to be taking to the next level of registering for being an organ donor. Uploading your health records. Any host information, health information provider that gets onboarded in ABDM becomes visible to the citizen. The complete digital health journey of a citizen from end to end is going to be in his palm, thanks to Aarogya Setu. We are going to be giving him the privacy which he wants, the sensitivity which he wants, the consent that he wants. I mean, if at any point in time, because consent plays a very major factor. If I do not want to share my with you, I should be allowed to do that. I should have the granularity to the extent that I'm willing to share the record X with you, but not the record Y. I should have that granularity with me. I should be allowed to define the period in which I'm sharing. It's for a week, it's for an hour, it's for a whole year, it's forever. But all that consent, everything should be in the hand of the citizen, which is what we have given. So today, if you go and open Aarogya Setu, you will be able to see the moment you register for ABHA, the moment your digital health record comes into it, you can see the consent management flow. So the citizen feels very empowered that he is in control of his health data. And it can be rest assured, it's a government app. It's where we commit what we are saying, we stick to what we are saying. The complete health journey is in your hands, the citizen's hand. So no health journey, no health ecosystem can be a success unless the citizens embrace it and get onboarded. So which we are trying, that our endeavor is that citizens start using it, start updating it. We have also given a provision that in addition to the information flow that is happening to the health information providers, you need not carry a bulky health record file with you, because over a period of time, all of us have gone through health journey, and whenever we walk into a doctor's office, we carry a whole bunch of file under our arm and walk in and, sir, this has happened to me in 1994 and this happened to me in 2004. So all that you can upload as part of the app, which you have it in your phone, on your button, the doctor as and when you want. So you have your complete minimized capsule of your health journey in your hand, which is what is an endeavor which Aarogya Setu is doing now. And with the tightly integrated couple with ABDM, we have achieved it almost, and we'll keep growing more with that.
Thank you very much for giving a wonderful insight into the background information about Aarogya Setu, about the history, and also about the prospective or the future applications those will get, or the features those will get into Aarogya Setu. Thank you very much, ma'am.